Good morning, all. I am Dr. Subhash Chandran from Immanuel College of Pharmacy. The topic which we are going to discuss today is Introduction to Powders. The powders can be defined as an uniform and dry mixture of one or more finely divided particulate matter of solid medicaments, or the pharmaceutical powders are intimate mixtures of dry, finely divided drugs or chemicals that may be intended for internal or external use. The powders represent one of the oldest dosage forms. It is a preparation in which a drug is blended with other powdered substances and used for internal or external purpose. The powder as a dosage form permits drugs to be reduced to a very fine state of division, which often enhances their therapeutic activity or efficacy by an increase of dissolution rate and absorption. The divided powders are also found to be convenient for administering drugs that are excessively bitter, nauseous, or otherwise to the taste. Although powders are not used nowadays extensively as a dosage form, they are widely used in preparation of various dosage forms. The powdered drugs can be mixed with other powdered materials prior to fabrication into other solid dosage forms such as tablet and capsules. The powdered drugs are frequently added to other ingredients to make ointments, pastes, suppositories, etc. A good powder formulation has a uniform particle size distribution. If the particle size distribution is not uniform, the powder can segregate as per to particle size, which may result in inaccurate dosing or inconsistent performance. And uniform particle size distribution ensures a uniform dissolution rate if the powder is to dissolve, a uniform sedimentation rate if the powder is used to remain in a suspension, and also it minimizes the stratification when powders are stored or transported. The advantages of powders are the following. The powders being a solid preparation, they are more stable than liquid and semi-solid preparations. They are convenient forms to dispense large doses of drugs. They can be better administered in powder form by mixing them with food or drinks. Since powders are in the form of small particles, they offer a large surface area and are rapidly dissolved in the gastrointestinal tract, minimizing the problems of local irritation. More convenient to swallow and a faster dissolution absorption than capsules or tablets. The powders offers a lot of flexibility in compounding of incompatible solids and possess good chemical stability. They are easy to apply and also they absorb skin moisture, which leads to reduced friction between skin surfaces, discourages bacterial growth, and has a cooling effect. They can be applied to many body cavities such as ears, nose, tooth socket, and throat. They can be made into many different dosage formulations like capsules, tablets, powders for reconstitution, dusting powders, bulk powders, powders for inhalation, etc. Highly compatible powders when compared to the liquid dosage form. The manufacturing of powder is economic, hence product cost is quite low as compared to other dosage forms. And coming to the disadvantages of the powders, they are less convenient to carry. Bulk powders are not suitable for administering potent drugs with low dose. Difficult to mask unpleasant taste of the drugs. Light fluffy powders may be inhaled by infants, leading to breathing difficulties. Variable dose accuracy, not suitable form for drug inactivity in the stomach or cause damage to stomach. These should be presented as entry-coated tablets. They are not suitable for bitter, nauseating, and corrosive drugs if they are meant for oral administration. Its difficulty of protecting hygroscopic, deliquescent, or aromatic materials and not suitable for drugs which are unstable in normal atmospheric conditions. and they are also susceptible to physical instability. Today we have seen about the introduction of powders. Thank you.